Hi guys, I'm Dr. Zainab Vora and I have with me Dr. Saumya who's secured the rank 40 in this INI CET exam. Congratulations, very well done. How are you feeling? How has the journey been like?
Ma'am, I the first thing which I felt was I was very relieved that
Yeah,
okay, like I don't have to prepare for another 6 months because
yeah.
yesterday only day before yesterday, my mom was with me and I was telling her कि मम्मा फिर से पढ़ना पड़ेगा नहीं हो पाएगा. So, but she was like नहीं हो जाएगा. So I was very relieved
Yeah.
and that was only and also I was very excited when I saw अच्छा okay, it's great.
That's a very underwhelming response, I must say. But I'm sure it will build up with happiness over as the
Yes,
time.
ma'am. Yes, ma'am.
And so your achievement, you've just made it very very small. So I think rank 40 is a very very big deal, considering the current level of competition. I mean, so what do you have to say about how your preparation journey has been like? What were the struggles, and how have you managed to reach this position?
Ma'am, in the big, matlab, ma'am, starting with MBBS in the
Hmm.
first year, I did not study at all
Yeah,
in the
kahan
first
se ho?
six.
Where was your MBBS from?
Ma'am, I'm currently an intern at AIMS Rishikesh.
Okay.
So initially when I came to college, I didn't know how to study, what to study, so I did not study
Yeah.
at all, but started studying towards the end of first year.
Yeah.
And then from second year onwards, I started reading all the textbooks. So I've read Robbins and uh, bits and pieces from Kadzang,
Yeah.
all of those textbooks. So, and then in third year, well, I was very consistent with my studies and focused on preparing, building concepts. I did not really think a lot about कि exam
Yeah.
के oriented पढ़ना है.
Right.
And in the third year, I completed third year subjects and final year
Yeah.
subjects. In final year, I
Yeah.
revised, and then internship, I revised again.
So you kept
This
it
thing.
simple. I think that is something which is also missing now, but that people are so aware of the resources, so aware of the competition that they take up a lot of pressure very early. And the only problem I sense with that is people are missing out on textbooks, they're missing out on clinical postings, and there is so much pressure that by the time you actually reach the point where you have to peak, you're already burnt out.
Yes.
So I think that's something which you said, it's so important that you keep it simple. You said third year mein third ke pade, fourth mein fourth ke pade, and that's how it should be, So just keep it simple. ये मत करो कि third year में first second revise कर लिया. Just keep it very simple and enjoy your MBBS. So that's also very important. And also shows कि अगर आपने first year में नहीं पढ़ा, like you said, आपका फिर भी rank 40 आ सकता है एक central institute exam में. And I'm also a very similar example only because मैंने भी अपना first prof में कुछ नहीं पढ़ा था. My anatomy sucks till date, So that's how I also was. So also one more myth busted that आप throughout MBBS एकदम पढ़ाकू टॉपर हो तभी जाके आपका रैंक 40 आ सकता है, ऐसा जरूरी नहीं है. So I think that's important. If we to go to internship, आपने internship में क्या रिवाइज करा, कैसे पढ़ा, how did you integrate different sources, so क्या strategy था?
So, ma'am, internship, ma'am, before my internship started, so I made a rough plan in my mind ki how should I complete. So I had decided that I would complete my first revision reading by July.
Hmm.
By July, this is what I thought because initially I thought that I was giving a lot of time, but I thought ki okay, chalo, let me just do it everything properly once and then I'll revise quickly.
Yeah.
So, ma'am, according to whatever I felt for my weak subjects, I divided the time maybe 7 days for anatomy, ऐसे divide करके, and then I completed my first reading by
Hmm.
I think July 15 or 16, and after that I was able to do two revisions, I think, and then one revision in the last 15 days.
Okay, so you were doing like revision videos, then you were doing main videos, BTR. आप तब क्या पढ़ रहे थे?
So, ma'am, for anatomy, I did revision videos from another source, but
Hmm.
I was not able to solve like questions properly from that. Then I referred to Ashwini sir's videos on YouTube. I think there is a free video of 5 hours.
Okay.
वो किया and cadaveric section का video है एक वो भी sir का I think 2-3 hours. तो दैट वाज माय रिसोर्स. वो 100 पेजेस का एक पीडीएफ बना लिया मैंने और वही रिवाइज करती थी टिल द एंड.
Hmm.
देन मैम फिजियो के लिए आई हैड डन फिजियोलॉजी बायोकेम लाइक वेल बाय
Hmm.
द मतलब फाइनल फर्स्ट ईयर के एंड में कर लिया था अच्छे से. So I read my main notes or and उनके points I annotated on my revision notes for physio. Then biochem, ma'am, I was good with biochem, so I watched BTR. So
Hmm.
ma'am, whatever I felt was tough, you had already like made tables and boxes, so my work was easy. So biochem के लिए I did BTR and then annotated the PYQs. Then ma'am, I was pretty confident with path, pharma, micro. So I did micro के लिए I did BTR notes because I thought कि if anything out of the blue comes, I'll be able to do it from whatever I've read in my formative years.
Okay.
And path I was ma'am confident with path, so I did my whatever main notes I had done.
Hmm.
Pharma also. Pharma I used to do how you used to tell कि सारा पढ़ के and then in one page you make a flow chart.
Hmm.
Like you had said, I think in one of the videos that pharma is simple only. You have to just study the drugs and you have to know the side effects. So I used to like after I had done a
Hmm.
particular topic, I used to take a piece of paper and write the drugs और उसके flashcards बना के I used to. That is how I have done pharma. And then ma'am, CFM ma'am, I struggled with CFM.
Hmm.
So I did BTR and I thought वो उसमें भी बहुत ज्यादा मतलब that I was able to do only that. And
Yeah.
then minors ma'am, BTR only.
Hmm.
Minors I have done BTR. Obs gynae, surgery and pediatrics I have done from the notes that I had made in my final year because I think the way I had learned in my mind, it was very difficult to adapt to a new resource. So
Right.
this is how I've done that. And my medicine was the integrated parts
Yeah.
like you have taught. That was my source for medicine.
Okay. Very interesting, that while doing internship, so I'm sure you were not getting your full day to study, at all. How many hours were you able to manage?
Ma'am, even if I get the full day, I am not somebody who can study for 12 hours or
Yeah.
13 hours. So I
Yeah.
used to study for, I think, 6 to 7 hours every day. That's it, ma'am.
Right.
And ma'am, in our college, internship is not very hectic. Like we get sufficient time. So
Yeah.
maybe I think that was an advantage which I had.
Yeah.
I had decent time. Like in most of the posting, except for general surgery, I was free after lunch. So I
Right.
had decent amount of time to study.
Interesting. So this was your very first attempt, right? At any
Yes,
exam?
yes, ma'am. And I have a 1.5 months of internship to go. So this was my
Wow.
first attempt.
Amazing, yeah. So I take back my words that you have not been a very consistent throughout. You need to take those words back. Because otherwise it is very difficult to get this, while doing your internship. A lot of times students का thought process ही नहीं होता कि चलो पढ़ाई शुरू करते हैं. They think कि internship हो जाने देते हैं, then we will start full-fledged. So that's also something which is very important कि शुरू कर दो जितना भी time मिल रहा है. Particularly if you have the luxury of a lighter internship, do utilize this time because this is where your knowledge is the freshest, if I can say that, right? अभी जो
Yes,
आपने
ma'am.
अटेम्प्ट दिया है वो आपका बेस्ट नॉलेज अटेम्प्ट है. इसके बाद इट योर नॉलेज फॉर पीजी एंट्रेंस इंक्रीजेस बट योर एमबीबीएस नॉलेज कीप्स फेडिंग. So I feel that worked to your advantage that this was your very first attempt and you were fresh out of your internship, so you had that clinical exposure, which was also there to a certain
Yes,
extent.
ma'am.
And also, you didn't complicate stuff as far as sources were concerned. You went back to what you had done. कि जो
Yes,
पढ़ा
ma'am.
था
Yes, ma'am.
वहाँ पे नहीं पढ़ा था वहाँ पे बीटीआर से सप्लीमेंट
Yes,
कर.
ma'am. Yes, ma'am. And ma'am, I've been watching your videos since final year. And one of my friends who had gotten rank 79 in this exam, I used to tell him कि ma'am, there's मतलब एक ma'am है, you should watch her videos. They're very मतलब that time I think BTR was not launched. It
Yeah.
was not an app. So and I think everyone in our batch is like watches. So ma'am, I've been following you, and I think the most important thing which I learned from you was how to study. I think that is something because you always say कि पढ़ के like after teaching 20 slides you always take a fresh slide and you make flow charts कि अच्छा this I remember and this is something which I don't remember, and then you get to know अच्छा this is something which I'm gonna forget, and this is how probably I'll have to make my small notebook or choti copy. So I think as I've said in my message also which I sent you, I think ma'am the most important thing which I learned from you was first how to study, and second, you always used to say it's just an exam, just an exam. So in my mind, okay, it's just an exam, just another exam. And third thing, which I was while I was traveling to the center a day before the exam. So in my car, I watched one of your videos, and in which you said कि अभी पढ़ लिया है, now go with a clean slate and use your common sense. So that is something which stuck with me, ma'am.
Yeah, I
Yes,
think the
ma'am.
fact that you give this exam with nothing to lose, that mindset helps a lot. It is
Yes,
something
ma'am.
which is very understated, but it's so important that when you give an exam with no pressure or baggage of the rank, which I
Yes,
believe
ma'am.
you did, that helps so much in looking at the MCQs without a bias. Otherwise, we
Yes,
always
ma'am.
have this कि मैंने ये पढ़ा है, मैंने इतना पढ़ा है, I need to know it. एक तो जो नहीं आता उसका बैगेज हट जाता है बिकॉज नाउ यू हैव फोर ऑप्शन इसमें से आंसर है व्हाट इज द
Yes,
बेस्ट
ma'am.
कीप इट सिंपल सो दैट्स
Yes, ma'am.
probably something very important so if we can discuss the exam day for you how did you approach the four sets उस टाइम पे क्या दिमाग में आप अपने आप को बोल रहे थे what were the things that you kept in mind while giving the exam.
Ma'am, surprisingly, like I as a person, I'm very chaotic and I get anxious over little things. But surprisingly, on the exam day, I was very calm, and that was like I'm
Hmm.
still surprised, like how did that happen? But I was very calm, and I went there. I think uh, very early to the center, and I went inside, and I was very relaxed. I don't know how I was very relaxed, and then I did not struggle. And then the exam I think started, and I did not struggle with time management because most of the questions were one liners. And even if I think there were in one of these sets, I think the third set, I did not know a lot of questions in one go. But then also you said this question bhi nahi aate hai, so it's okay. You can always get 10 probably easier questions. So, ma'am, I think the thing which probably helped me was that I was very calm and I
Hmm.
was able to think and rule out options.
Yeah.
And yes, ma'am.
ग्रेट एंड एंड में आपने कितने अटेम्प्ट करे होंगे टोटल अटेम्प्ट एंड व्हाट वाज योर स्कोर.
Ma'am, I got 170 questions correct, and I attempted, ma'am, 197 in the scorecard. It is 197. I'm not sure actually how many did I attempt
Yeah,
that day.
because of the sets. Yeah, I mean,
Yes,
it's hard
ma'am.
to.
Yes,
Great. I
ma'am.
mean, 170 corrects in your internship year. It's a very big deal. Let me just tell you that. So
Yes,
very
ma'am.
well done. And I think
Thank you, ma'am.
if you just said it so simply that it feels a little hard to believe. But the simplicity is the key. That don't overcomplicate it. Back yourself up and give a good exam. End of the day, the answer is in front of you. Just go
Yes,
back
ma'am.
with a very relaxed mind and give your best exam. जो भी पढ़ा है, just back that. You don't have to
Yes, ma'am.
do every resource which is out there. You did. I think the least resources out of anybody who would have given this exam because of the time. I mean, I'm sure if you were
Yes, ma'am.
now you would have done more, but because of the time and still, so that just goes on to show that it's not the resource, it's the person, of how you approach what you have been given and how do you give the exam. That is what matters in the end.
Yes, ma'am. Ma'am, I was planning on doing all the compiled modules and everything, but I just didn't have the time. So
Yeah.
I could not do it. So I thought, okay, fine. I have done it. I had done it once. So I thought, okay, if
Yeah.
something comes, then I'll probably, but I did not feel anxious, I think,
Mm.
in the last few days, probably because my mother was staying with me. So
Yeah.
she made me feel very relaxed. And there's something which my father said, which stayed with me. I called him up and I said, Papa, मुझे डर लग रहा है, नहीं हो पाएगा. So he said कि इसका नाम परीक्षा इसलिए है क्योंकि तुम्हारी इच्छा नहीं है. And I think, okay, that helped me detach myself from the
Yeah.
outcome probably. So I was relaxed and I did what I could, and I went with a clean slate, like you always say, Mama.
Great job, Soumya. And what is your final message to your juniors who are watching this, who want to do something that you have managed to do so early in your career? What is it that you want to tell them about MBBS in general and how to approach MBBS and internship?
Mm. I'll say that consistency is the key.
Hmm.
And even if there are certain setbacks which were there in my preparation also,
Yeah,
you can always bounce back if you have the support of your friends and your family.
yeah,
And be disciplined. Don't try to do everything,
Yeah.
and only do whatever you think you will be able to revise in the last few days. And I think something which happened to me was, don't attach yourself too much to the outcome. I mean, just do your job, take
Yeah.
one day at a time, and don't think about the fact कि मुझे top 50 लाना है, top 100 लाना है. I think God will reward you, and the universe will reward you for what you have done. You can just, because in my case also, there were certain GTs I didn't perform well, but I did not take it very seriously, because
Mm.
like it's gone now. It was a test, and now it's just gone, man. It's
Yeah.
not the final exam at the end of the day. Don't take GTs too seriously, and don't lose your peace and sleep over it. Analyze your weak subjects, see your mistakes, and move on. Like, it's not the final paper. And yes, ma'am, that's it.
Amazing, amazingly put and summarized, and I'm sure this gives a lot of insight to your juniors as well. Thank you so much, Soumya. Let me just say we are so proud of you.
Thank you, ma'am.
Continue to do your job with so much passion and so much ease as you display. So all the very best, and may God bless you always.
Thank you, ma'am.
Thank you. Thank you.